Assalamu alaikum, dear students. I will be talking about basic principles of drug administration. JK Bose 11th class students, this is prescribed in your syllabus. This topic is in unit 3rd, page number 24, session 3rd. Dear students, so the topic is basic principles of drug administration. Before going to our today's topic, you must know what is drug administration. Dear students, what is drug administration? The giving of a therapeutic agent to a patient, example by infusion, inhalation, injection, paste, suppository or by tablet. Dear students, it means the way through which a drug makes entrance into body or applies on various surface of the body. So that is the drug administration. Dear students, for a nurse, safely administering medication to patient is an important job duty. If you are a nurse, you must be knowledgeable about the medication being administered. You must also be ensured that the right medications are given to the right patient in the right way. So, dear students, in this lesson, you will learn about some of the principles of medication administration. So, what are the principles of medication administration? Dear students, when you give medication, you want to keep in mind that the goal is to help your patients improve their health. Okay. So talk with your patients and give them information about the medication. It's a patient right to know the name, purpose, possible side effects of the drug they are given. Dear students, to promote safety, you want to remember to wash your hands properly before and after handling the patient. Dear students, before giving to drug administration to the patient, you want to keep in mind the 6 rights of drug administration. Dear students, one of the main principles of safe drug distribution is to practice the right of medication administration. So, the 6 rights of medication, we can sum the rights that a nurse needs to give the right client the right drug in the right dose at the right time. That is the right route, and when that is all done, the nurse must provide the right documentation. Dear students, let's look at each of these rights a bit closer. So these are the 6 rights of drug administration. The first is the right person, second is right medication, third is right dose, fourth is right time, fifth is right route, sixth is right documentation. Dear students, so we will discuss all these in one by one. First, so this is the right documentation, this is the right route, this is the right time, the right dose, right medication, and right person or right patient. So first is the right patient. Dear students, making sure you have the right client might sound trivial, but it's not. You must check the identity of the person before you help them with the medication. Okay. So this is the right person. And second is the right medication. Dear student, the right client must be given the right drug. Don't use any medication that has a label that you cannot read. Dear students, do not use any medicine unless it has a complete label. Read and double check the label against record at least 3 times. And the students, tell the person the name of the medication before you help them. If a person says they do not get this medicine, stop and don't help. And dear students, report this to your supervisor or doctor. If a patient takes the wrong medication, it must be reported to the doctor or supervisor immediately. And students, This can be tricky if a generic version of a drug is being used in place of the brand name drug. Some medication have similar spellings, such as Percocet and Percodan. Both contains oxycodone, but Percodan contains aspirin. Percodan contains aspirin, which a patient might not be able to tolerate. Okay, so this is the right medication. And third is the right dose. Right dose. Dear students, you should keep in mind, check and double check the dose. Score tablets must be cut in half if the label says half tablets. Okay. So dear students, if it is an error when a person takes a medicine with the wrong route, so this is an error, must be reported to the doctor or supervisor immediately. Okay. So next is the right time. So the right time is 30 minutes before and up to 30 minutes after the time on the bottle and the order. Example, a person can take medicine anytime between 9:30 a.m. and 10:30 a.m. If the medicine is to be given once a day, it is an error if it is taken at 9 a.m. or at 11 a.m. This too must be reported to the doctor immediately. Okay, this is the right time. And next is the right route. Dear students, check and label to find out the right route. A buccal medication should not be swallowed. That is in oral route. It is an error when a person takes a medicine with the wrong route. This also must be reported to the doctor or supervisor immediately. Okay? Oh, and next is a right documentation. Right documentation means students, all documents must be complete and accurate. Means a medication that is taken, forgotten, held, or refused by the patient must be written on the patient's medicine record. Other information like vital signs and apical pulse rate must be recorded when it is needed. For example, the apical rate for a full minute must be taken and recorded before a person takes digoxin. If the rate is 54 or more, the person can take it. The dose must be held and the supervisor must be notified if the rate is less than 54. This must also be written in the person's record. Dear students, complete medication record must include the details like full name, room and bed number, age, and signature of all who have helped the medicine, name of the doctor, description about allergies, dose for each medicine, route for each medicine, form for each medicine, date and time that order was written. Okay. So next, these are the six rights of medication, that is right person, right medication, right dose, right time, and right route and right medication. So dear student, this was all about today's topic, basic principles of drug administration. Thank you.